So we are applying very powerful algorithms and very realistic algorithms within the Damu Sasa product to ensure that blood appeal is serviced. You know, we are truly interconnecting the ecosystem to ensure that no one dies due to lack of blood when we can apply a system that can address that. For example, we recently signed a partnership with the O Negative Foundation Kenya. I'd like to encourage any innovator that is out there that believe that you can do it. When we started, our concept was so easy, you know, but when we went on the ground to actually try it out, we found other people who are willing actually to help us address that. The target users, the partners, you know, the funders, the investors that now we have on board. It's like the universe has converged to ensure that we achieve this one big desire of saving out lives out there through digital healthcare solutions. So if you're an innovator out there, believe in yourself, go do it, and there is an opportunity for you to grow through so many ways.
Hi there, welcome to AI Healthbeat Africa, the podcast where we explore how artificial intelligence is transforming healthcare across the continent. I'm your host, Valentine Kamau. This episode is brought to you in partnership with Unicaf, an organization that is expanding access to quality, affordable higher education across Africa through its scholarship programs. Now, today, we are talking about an important part of the health system that is often invisible: blood, the resource that powers human life. I'm joined by Kilemi Thambura, a co-founder at Damu Sasa, a platform that is using data and technology to make blood services more accessible, equitable, and efficient. Welcome to the show, Kilemi. Happy to have you here.
Thank you so much, Valentine, for having me.
Yeah.
I appreciate it.
Good. So it's really a pleasure to have you here and to know what Damu Sasa is doing, especially in terms of the health system strengthening, what you're doing in terms of the blood technology. And so we'll just get right into it. You can tell us about your journey, how you came into the health tech ecosystem. Yeah, over to you.
Yeah, so my background is technology, but I've always been drawn to real problems in the world. So Damu Sasa is an end-to-end blood services solution. We look at how blood flows from sourcing until usage. So we look at the entire blood services value chain, right from collection all the way to the transition. Our journey started because we realized that one of the biggest challenges in the blood services ecosystem is not that blood is not usually available, but it's because there is no connection of the systems within the ecosystem to ensure that blood reaches to the patient when it's required and on a timely manner.
Okay, and how did this come about? What sparked you to develop such a system? The founder story, how did that come about?
So we were inspired by the Westgate Mall terror attack of the year 2013. There was a call for blood donation after the terrorism happened. We and the victims of the attack that were taken to various facilities within Nairobi. So I was within the CBD then, together with my co-founder, and it started as a simple conversation. How do we make it easy for any Kenyan who is willing to donate a unit of blood for the victims to donate from wherever they are? Because you'll agree with me, if you are within the outside Nairobi, let's say for example you are in Meru County and you'd like to contribute in the donation, it becomes a challenge for you to come all the way from such a long distance to the town. And it's the reality with most of the Kenyans. But most important is that you're willing to save a life through donation. So our desire was to make it possible for any Kenyan to donate blood from wherever they are. And if I'm here within Nairobi County, I'm able to go on the Damu Sasa platform and I'm able to see Valentine has donated blood. She is in Mombasa County, she is in North Rift region. And by that you're able to answer the question of where is blood. So the only question now you remain with, how do I courier it from where I've seen it is up to where it is. So you can see our desire was to bring the aspect of the connectivity. So that's how we ended being the connective layer within the blood services ecosystem. Yes.
Okay, that is really amazing. And how would you describe what is the current blood ecosystem? How was it structured even before Damu Sasa came into play? What was the gap there? How is the structuring done? And then link it to now where Damu Sasa comes in, how you've gotten into that ecosystem.
So the ecosystem itself has got the blood donors, you have the blood banks, and you have the hospitals that require blood. So this is where there is no that connectivity. So, but usually the biggest pain points in the blood services ecosystem is usually the relationship between the donors and the facilities that need blood. So you find that it's not usual for majority of potential donors to show up in a facility to donate blood to save a life. So you find that mostly we depend on what we call replacement donors or the family donors. We usually show up in facilities to donate when they have a friend or a family member who requires blood. And that's why as a country we end up not meeting our demand as required by the WHO, at least to meet 1% of the country's population. So you find that the biggest problem is sourcing that blood. You get, so blood has been sourced. It's within the ecosystem. But again, there is no interconnectivity within the ecosystem. So you find that most of the time people can donate blood, for example, during emergencies. But now how is that blood distributed across, you know? So you find sometimes
facilities.
Correct. So you find sometimes blood could be in one place. But it's not in the other, somewhere where it's required, you know? So we had the desire of connecting the ecosystem to enable the stakeholders to see one another within the ecosystem. So if it's for the facilities, they're able to see one another. If you are facility A, you're able to see what facility B has in stock. Sometimes facilities may having blood that is about to expire simply because the patient that they have at the moment are not in need of the blood that they have at stock. But your neighboring hospital actually requires a unit of blood that if you are able to see one another, you're able to exchange and save lives. Yes.
Great. So you're solving the problem of blood wastage and even blood shortage.
Correct. Yes.
Okay. And how has now technology come into play, and how are you using it within your system?
So, like I mentioned earlier, our technology looks at the entire blood services value chain. So when you go to collect blood, how are you engaging donors? So we have, within the platform, we have built what we call the donor relationship management module. And I'm calling it relationship because we are eliminating the aspect where you just have to register donors and then you have to call them when you want to call them to come and donate blood, which sometimes is looks like what we call a transactional way of doing it. But for us, this module comes to change how you engage the donors by forging a relationship with them. So for example, if I register a donor, I'm able to engage them intermittently to ensure that by the next time they're eligible to donate blood, I'm actually able to win them. Or sometimes we have had cases with some of our client facilities where actually a donor shows up without you having to recall them, you know, because we have designed our system in a manner that the system is able to engage them occasionally to ensure that you keep them reminded on educating them on the importance of blood donation. And actually we have taken a step further to indulge in a research with the University of Nairobi through Vilgrol Africa, funded by IDRC, to ensure that we're able to understand what are the factors that bewilders the blood services ecosystem. You know, how are we able to increase donations? You know, and the research looked at how we are able to engage the members of the public, or rather, let me paraphrase that.
Yeah.
So we indulge in a research with the University of Nairobi, and the objective of the research was to be able to understand the factors that contribute to shortage of blood in the country. You know, so by understanding the donors, we are able to address those issues through technology on an ongoing basis to ensure that you are able to win the donor. You know, for example, for female, they are eligible to donate after 4 months. The male is eligible to donate after 3 months. So how do you win that person the moment they register with you? You know, and our system is able to do conversions, and we have had conversions rate of over 40%, where by registering a donor through that registry, how the system is designed now to engage the donors after incorporating the outcomes of the research, you are able to win that donor, and they're able to, sometimes you have had people show up in a facility and they tell you, I was reminded by Damu Sasa to come to donate blood. Something we have never seen before. But with technology, you can see how we are closing that gap.
You're closing that gap.
Yes.
That is amazing. And how does a normal person, for example, someone listening who has never donated blood, how do they get enrolled onto your platform? How do they do that?
So we have a publicly available platform that you can simply go online. If you Google Damu Sasa, you're able to see a platform that is able to show you how you can even contribute to donations. You can see blood appeals that are required. You can simply enroll on the platform, and you're able to become part to be educated on the blood services. But beyond the platform itself, the web-based hub, we have an AI chatbot that you can access through your WhatsApp. The phone number is 0756 177 400, and you're able to interact with the application. The application is able to, for example, respond to you if you need to donate blood within your vicinity. The app is able to send you the nearest location with the contact people within the facility where you can show up to donate blood. And also it's able to respond to your queries with respect to blood services. For example, let's say you have a question whether blood is sold, for instance. The app is able to educate you around that. If you have questions around whether blood is voluntary, the app is able to educate you. So we have trained the app through a model called retrieval augmented generation. It's trained within the Kenyan context ecosystem to be able to educate the public on blood services queries.
That is really innovative, and especially integrating with WhatsApp, which we are using every day. So we will definitely leave a link how to access the chatbot. And now that you've even brought in the AI layer, how has that been in terms of the data you're using? We know all these things that come with training the AI models and even for the chatbot. For our context, how have you gone about the data sovereignty, data privacy? How are you bridging that gap?
First and foremost, we have been quite creative in how we design our systems, even following the personal morals and ethics in terms of designing these solutions. We have been first to start with us. Morally, how am I designing a system that I know it's going to impact lives? And then besides that, we are compliant with the Kenyan laws around data privacy. For instance, we have the Data Protection Act of 2019, which guides on how people's data is captured, how it's processed, and also basically it's a framework that guides vendors like ourselves who are developing healthcare solutions in the place. How do you adhere with these laws that the regulator, the authorities have provided to guide us in the space to ensure that we are in adherence with what is required. And then we do thorough testing of our solutions before we go out there. You know, are they secured enough to ensure that we do not violate people's privacy and rights by the time they're going there. So in a nutshell, that's who we are, you know. We are also licensed by the Office of the Data Protection Commissioner. We are registered with them as a data controller, and we are very keen to observe what the authorities are guiding as far as operating within the laws is concerned.
That's really good, especially being compliant with what is there, and just using even the AI layer and to just make your services more accessible and even more efficient. And now that brings me to a question on, we know the infrastructure, especially in Africa and even in Kenya, in terms of connectivity and all these things that are needed to run such a system. How has it been integrating into the different health facilities, and what are those gaps? What is needed? What do we need to improve?
Do you mean like?
So, for example, the health facilities that are taking up the Damu Sasa service management for blood, are there some that perhaps face some challenges in using it because of internet connectivity, electricity, all those infrastructure gaps that perhaps even rural health facilities don't have access to?
So first, Damu Sasa thrives on a pre-existing infrastructure. So for you to fully leverage on the value of Damu Sasa as a facility, at least you have to have a pre-existing infrastructure as a facility.
You're integrating.
Yes, and most of transfusing facilities in the country, actually they have at least the local area network within their facility, where they can, already before even Damu Sasa went on the ground, these blood transfusing facilities, they had pre-existing infrastructure. So some of them are already running other solutions such as the hospital management information system. So the same with Damu Sasa being a technology solution, we go and thrive on leverage on the pre-existing infrastructure in these facilities for us to do the deployment. But on the question on the rural facilities, sometimes we have gone an extra mile with our partners to actually provide advice on how on the minimalist, what do you need to do as a facility at least to run the Damu Sasa solution. So sometimes we bend the advice, the expert advice on what you need to do as far as the infrastructure is concerned within these facilities that have got the missing technology element, or now you can ride on the Damu Sasa. But a substantial percentage of these facilities, they already have pre-existing infrastructure within these facilities.
Okay. And you've mentioned something about capacity building for the health workers. How do you go about that? Is it training, or how does that happen?
So before deployment, we usually have trainings. We have the training of trainers who then go and train other targeted users. So we have a structured mechanism when it comes to the deployment of technology to educate the target users. And then even post-deployment, we have in-person trainings with these people where we hold them until they are fully on board on how to use the technology.
Okay. That's really good, especially the aspect of even deployment, you're already integrating into the existing workflows, meaning you're not already adding a burden into already the burdened healthcare worker, and then the ongoing training even post-deployment. I really like that aspect.
And also looking at our chatbot, our AI chatbot, the WhatsApp penetration in the country is over 90%.
Yeah.
So the reason as to why we went the WhatsApp way, it's because it's easily accessible. WhatsApp is something that anyone, even in the rural area, most of the people can easily access through a smartphone. And it's very instrumental when it comes to educating the members of the public on basic things about blood donation. So like the outcomes of the research that we did with the University of Nairobi, we are incorporating them within the chatbot to be able to drive the message to the people to educate the more of the civic education. And also, if you look at the Kenyan policy around blood donation, we have also trained the chatbot around that, just to ensure that we do not go beyond, you know, and that's the uniqueness of training an AI chatbot through the retrieval augmented generation, because you only focus within a particular domain. You find that the WhatsApp chatbot is not hallucinating like what we have seen with other AI large language models hallucinating whenever they ask questions. So for these Damu Sasa WhatsApp chatbot, it's able specifically to address the blood donation queries or gaps that are pre-existing out there, to ensure that we are able to educate the people there, not only the people within these transfusing facilities, but even the members of the public. Yes.
Yeah. Okay. I like that explanation, especially on the no hallucination of the AI chatbot. That's amazing. And now, actually, building on that layer, we'll go into a segment called AI Fact or Fiction, and I'll just read out some statements, and then you can educate us. Is that fact or fiction, and why? Yeah. So here goes. Blood shortages in Africa are due to lack of donors. Would you say that is fact or fiction?
I would say that's a fiction, because donors are there. Like I said, people donate blood, but there is that element of no connectivity. You know, so you find that people have donated blood somewhere, but there is a lot of surplus in one particular area, and then there is a demand in another area. So you find that there is no connectivity. So people actually donate blood, but you find there is no that connectivity. And like during emergencies, people donate a lot of blood because there is that compelling.
There's a call.
There is a call. People want to donate blood towards a particular cause. Like I gave the story of the Westgate Malta attack. There was so much blood donation in Nairobi. Sometimes it can go over surplus. But let's take another county that is running low of blood. You know, so people have donated blood because there is a need for blood for the terrorism attack. But you still have delivering mothers in other counties. You still have accident victims in other counties, you know, who are in need of blood. So blood is in Nairobi. There is a demand in Kiambu County, for instance, or Murang'a County. How do you enable those counties to see one another and actually redistribute blood across? You know? So I would say that's a fiction.
Okay. Good. Next, digitizing a blood bank's record solves the problem of shortages.
Absolutely. And I will tell you how, from an experience perspective, we have witnessed that. When we were doing a pilot at the Kenyatta National Hospital, because Damu Sasa has been built with the ecosystem players, we witnessed firsthand where Damu Sasa was able to reduce the loss of blood units through expiry, for instance. You know, we were able to reduce the loss of blood units through cold chain violation. You know, so I've seen firsthand what technology can do when it's optimized at the blood bank level in terms of resolving such kind of issues. Even doing an audit trail to understand how did a unit of blood flow from the moment it entered a blood bank. It goes a long way in ensuring that that unit of blood was well utilized after the fractionation of it was done. You know, a unit of blood can go a long way of solving up to 4 lives. You know, so if the patient, for example, requires a platelet, what was requested from the blood bank? Did you request a whole blood? You know, if you request a whole blood instead of the specific product that was requisitioned from the clinical area, you can see what that does. It makes the 3 other products within the blood product not be used to the rest of the patient. So applying technology can enable you match what is requested from the wards where the patient are to actually what is being issued out at the blood bank. Yes.
Yeah, that is a good, gives a good lens on the continuity from donor to patient and even usage, giving a whole ecosystem view of how that pint of blood from donation, how it travels through the whole system. That's really great. And so this brings me to something about the numbers from the time the organization was founded to now. Would you have a number on the number of lives impacted, or how have you measured that impact? Because you have really been recognized in different platforms on, you know, the change that you're making within the health system. Would you share with us the numbers, the impact, and moving forward?
So statistically, we have impacted over 55,000 lives.
Wow.
And I can tell you how we measure that. So I mentioned how we do the blood collections from donors, how we track that unit of blood until it's used at the ward level. So we measure this by tracking the usage statistically. We're able to pick, for example, how many delivering mothers utilized what blood, let's say at a level 6 hospital, you know? How many cancer patients utilized what type of blood group within a facility, you know? How many orthopedic patients utilized what unit of blood within a facility. And this data that you're able to pick statistically, if I'm able to save a unit of blood, or if I'm able to track a unit of blood until it's transfused to a patient, and I will go, allow me to speak to the cost, to the associated cost in preparing a unit of blood until it's ready for transfusion to a patient. It costs around 20,000
for 1 unit. Wow. Okay.
Around 20,000 to prepare a unit of blood until it's ready for transfusion. So if I'm able to save a facility from losing that unit of blood, either through expiry, either through cold chain violation, until it goes to the patient, you can see even in terms of the associated cost, how much Damu Sasa is saving a facility from a revenue perspective. Yes.
Okay, that's a really good cost saving measure, and especially with the aspect of how financing is done for health facilities, cost saving is always very good to have. And now in the ecosystem that you've been working in, definitely partnerships play a key role. And how has that partnership model been working in terms of perhaps bringing in other private sector actors, government, public system, development partners? Take us through the partnership angle. How has that gone?
Partnership has been quite instrumental, looking at when we started Damu Sasa up to where we are today. And I'll give you instances of partners and examples of partners who have been quite instrumental in our growth. So when we completed our pilot at the Kenyatta National Hospital, our very first partner to come on board was the AIforGood Africa. You know, so with AIforGood Africa, before the outbreak of COVID, we were able to traverse almost all the 47 counties. Before the COVID came, we did 38 counties.
That's amazing.
You know, that was during COVID time. And through AIforGood Africa, we were able to run the containment measures. We were able to run blood drives amidst the pandemic. You know, in the middle of the pandemic, we were able to run blood drives using our our booking feature,
Yeah.
you remember the Ministry of Health gave guidelines on how, with respect to social distancing, where people were not required to overcrowd in one place. When it comes to blood services, definitely the culture is people show up. Very many people show up in a place to donate.
Yes.
But during COVID, we introduced the booking feature. You know, where the booking feature was out there in the public.
Yeah.
People would book to donate from any facility.
Yeah.
And they would be queued,
yeah.
you know, to ensure that so many people do not show up in a facility
at the same
time.
Yeah.
So together with AMREF and the Ministry of Health, and it's the Ministry of Health that we actually gave us the opportunity to actually take the Damu Sasa solution out there during COVID to ensure that blood drives went on in the middle of the pandemic. And we did it so successfully.
Yeah.
Other partners that came into play were Kenya Red Cross. We had the United Nations Population Fund, who has been quite instrumental even up to date.
Yeah.
And then besides that, that was during our early stages of growth.
Yeah.
And then as a post the proof of concept, we have had Vilgrol Africa that put us in an incubator that played a very crucial role in terms of polishing us from a professional perspective to ensure that we are ready even for more growth. We have had Vilgrol give us their professionals who came to take us through different to show us various ways on how to do these things as a company. And that's how we were able to be investor ready, you know, where over time from the experience that we got from Vilgrol Africa, we have been able to raise money through other investors who have contributed to our growth. And right now we are closely working with the Impact Investment. Impact Investment.
Okay, that partnership is a really sounds like it has really been key in your growth. So, and now you've actually brought me to the next question on, you've mentioned about being investor ready, being polished enough. And so looking at the landscape in Africa of the budding health tech innovators, what advice would you give in terms of, I have this idea, how do I go about it from concept stage, you know, going through the different rounds of perhaps incubators, accelerators? How would you give that founder? Tell us about that journey that would help someone else grow.
The very first thing that I would, the advice that I would give is you have to embrace a lot of patience. You have to be open for partnerships, you know, because these play a very big role when it comes to taking off your idea to growth.
Okay, so that aspect of especially the upcoming innovators, perhaps talk about two things that they would need to look at in the context of Africa in terms of their health tech innovations. How would they go about? For example, you had the idea of solving the problem of blood shortages and blood wastage. What would you say they need to look at exactly to solve for Africa in a way that makes sense for us, works for our realities?
So first you have to identify a problem that is pre-existing, because you have to innovate against a problem that is truly existing. And then you have to innovate with the target users. You know, like in our case, we did not just theoretically think about the idea and go back to our seats and develop based on how we are thinking it. We had to go to the target user and develop with them as opposed to for them. Because when I develop with the user that I'm targeting, there is a high likelihood that I'm going to get it right. You know? And my entry to the market is going to be easier as opposed to me just doing it behind the doors, you know, and thinking that this is how it's supposed to work. So there is power in feedback, you know. Feedback plays a big role when it comes to polishing the idea, and it goes a long way to helping you get other referrals, because today you may try a solution with one target user. Tomorrow they're the ones referring you, because it's an ecosystem. It's a problem that they themselves know. So when they truly feel that you have done something with them, they are going to help you to grow. And even refer you to the necessary partners for you to move forward.
So it have the target user in mind. And for the context, the problem they are hoping to solve. That's really good. And so now as Damu Sasa has grown, and you also earlier as we were talking, you were telling me about the other company, Gigi Health. If you can talk a bit about that and what you're doing in the larger health ecosystem with Gigi Health, and also how has growing that company been, bringing in the right talent to optimize your growth?
So Damu Sasa was looking exclusively at the blood services. We were in the market for quite some time. And from what we were doing, people approached us and asked us, our clients, and they asked us, what more can we give them? It became a challenge to sell in other capability, for instance, a hospital management information system within a blood services company. So we had to evolve ourselves from the Damu Sasa brand to what we are calling Gigi Health, for us now to embed other capabilities that we found we could develop within Gigi Health. So we had to evolve from Damu Sasa now to Gigi Health. Basically, it's repackaging ourselves so that we are able to sell these other capabilities as a company that we are developing internally. Like right now, we have a hospital management information system that has got quite an interesting model on how we are capturing the market. We have a learning management system for capacity building within the healthcare ecosystem. We have an e-learning platform. And we are still going on. And our development is based on need that we are identifying out there, especially from these clients who have been our customers with the Damu Sasa product.
Amazing. And so as we are just nearing the close, I would ask, for example, if all these challenges that you encountered as you're growing the company and solving the blood ecosystem problem, within 10 years, where would you hope this blood ecosystem is for Kenya and even for Africa? Because I believe the Damu Sasa solution is something that is scalable across Africa. How would you see 10, even 20 years from now?
In a decade's time, I see an interconnected ecosystem. We look forward to having interconnectivity. Not only in Kenya, but beyond Kenya and Africa at large. So that, because remember I mentioned, blood could be there. But because systems are not interconnected, you find that lives are getting lost simply because there is no that connectivity. So in a decade's time, I hope to see an interconnected ecosystem within the African context to be able to have the full effect to the ecosystem with respect to saving lives.
That's a very good outlook. Saving life is at the core. And now just to tie everything together, especially for our African context, one of the things that we are well known for is our proverbs from our ancestors, and they are always our guiding principles in everything that we do. So I will read this proverb and then you can just elaborate it in the context of what you have been building within the health space, and just take us through that. The proverb is, rain does not fall on one roof alone. How would you
It's from which country? That? Where did you get the proverb from?
It's just an African country, no specific one,
Okay. So in the context of what we are speaking about, I would interpret that to mean that problems are shared across board. And we cannot act in silo for us to resolve these problems. We have to bring our solutions together for us to address these problems that are shared across board. So back to the point that I'm raising about integrating solutions, interconnecting, solutions to be able to address these problems holistically. Yeah.
Okay, that's a very good elaboration. So it's about the health system is all connected and challenges cut across, and now your solution is helping solve that.
Correct.
Amazing. And now as now we close, you can perhaps anything that we did not touch on that you would want to talk about, and then mention again where how we can go about the blood appeal and anything else as your closing statement.
Thank you for that. So for the blood appeal first, if you ever have someone in need of blood, you can always access our platform and place that appeal within the Damu Sasa platform. It's accessible online. Just search Damu Sasa appeals and it's going to give you a link that you can access through your mobile phone, you can access through your computer, and it's a less than 1 minute way of doing the blood appeal for someone in need of blood. And the algorithm that we have applied in ensuring these appeals are effective is we enable you to reach out to potential donors within the ecosystem that would be willing to donate a unit of blood for your patient. For example, we recently signed a partnership with the O Negative Foundation Kenya. That's one of the rarest blood groups as far as the blood services ecosystem is concerned. But they have a membership of over 900 donors of O negative. And now they are within our ecosystem. So you can imagine if you're placing an appeal of someone in need of blood group O negative, what that means, or the probability of you getting someone who can give you that unit of blood. Besides that, our ecosystem has got so many registered facilities that are already using our platform that whenever you place a blood appeal, it can easily go to a facility. Remember I mentioned sometimes blood could be in a hospital or in a blood bank, but it's not in use. And that lab technologist who is within a facility, they may see that blood appeal and actually confirm that it's available. So we are applying very powerful algorithms and very realistic algorithms within the Damu Sasa product to ensure that blood appeal is serviced. We are truly interconnecting the ecosystem to ensure that no one dies due to lack of blood when we can apply a system that can address that. To your other request in terms of my parting remarks, I would like to encourage any innovator that is out there that believe that you can do it. When we started, our concept was so easy, but when we went on the ground to actually try it out, we found other people who are willing actually to help us address that. The target users, the partners, the funders, the investors that now we have on board. It's like the universe has converged to ensure that we achieve this one big desire of saving out lives out there through digital healthcare solutions. So if you're an innovator out there, believe in yourself, go do it, and there is an opportunity for you to grow through so many ways. We are here today. You are granting us visibility in terms of what we are doing. That's another partnership. That's another way of you coming here to help us take to the world, speak to the world, let the world know what we are doing. And we appreciate you for that.
Okay.
Thank you.
Thank you so much, Kilemi. I really like that aspect of believe in yourself and go out there, and somehow the universe converges to make your dreams come true. And definitely Damu Sasa is one of the strongest health system enablers, and what you're doing is very revolutionary. So keep doing it, keep saving lives through your Damu Sasa platform and GG Health. Thank you for joining us.
Thank you so much.
Thank you for watching and listening. This has been AI Healthbit Africa. This episode was brought to you in partnership with Unicaf. Check out all the links at the description box for both Damu Sasa and for Unicaf, and see you on the next one. Thank you. Bye.